What is the difference between benguicula and pterygium? What is benguicula and what is pterygium? Okay.
Pterygium is usually like a soft tissue. It's extending towards the pupil and it can invade the vision, so it can affect the vision, but it's not the case with benguicula.
Okay, perfect. Thank you so much, Dr. Fatma. So pterygium is a soft tissue, a fleshy colored tissue. Okay, sometimes it can be slightly pinkish in color, which extends from what? Extends from the white part of the eye and can extend to the clear part of the eye, which can also cover the colored area in the eye. So again, it's very confusing. So what does that mean? So it can extend from the white part. So remember, what is the white part of the eye? What is it called?
Conjunctiva.
Okay. And what is the clear part of the eye?
Cornea.
Sclera.
Sclera.
Oh.
Yes, sclera. Okay. And what is the dark colored part of the eye called?
Iris.
Iris. Okay, perfect. So again, so it can start at the white part, go to the clear part of the eye in front of the eye, which can also include the colored part of the eye, and this can actually cause vision difficulties, and can also cause loss of vision. Okay, so this condition tend to progress. There is some sort of treatment for it, but in many cases it tends to progress and can affect vision. What is the reason behind that? So why patients can get that? So many reasons. It used the pterygium, it used to be called surfer's eye. What could be the cause of pterygium? Anybody knows? What is
it usually allergy or exposure to some triggers, pollen or humidity, and that can cause thickening of the sclera, and it gets worse every time we are exposed to the dust.
Fine. Thank you so much, Dr. Fatma. Yes, so the reason behind that is basically, why is it called surfer's eye? Because surfers gets exposed to sunlight, get exposed to wind as well, and also they can be exposed to dust, but less likely. So three things: sunlight, wind, and dust. Okay, who else can be exposed to sunlight, wind, and dust? So for example, people, people, workers who work in sub-Saharan countries like, Saudi Arabia, like Gulf countries, can also be exposed to that. So they're it's very common to happen there, because they are actually exposed to the three of them. They get exposed to wind, get exposed to dust, get exposed to sunlight. So three of them can cause pterygium. Okay, is it cancer? No, it's not cancer, because many people tend to think about that it could be cancer. However, it is not cancer, but it can get worse. So how can it get worse? It can cause a specific condition. So anybody knows about the name of the conditions that it can cause? Okay, it can cause astigmatism. It can cause astigmatism. But not only astigmatism it can cause, it can also affect vision if the the fleshy part covers the whole small dark dots in the eye. So this means that the patient will be unable to see at all at some point. So it can cause also loss of vision. But benguicula, just a single spot or a couple of spots that can happen. It's yellowish in color next to the iris and the cornea, and usually closer to the nose. Okay, and also, by the way, pterygium is closer to the nose as well, mainly closer to the nose. There are lots of theories about why is it mainly closer to the nose, or like on the nasal side, but it means that actually mainly the eye, the light reflection is mainly around the nasal side of the eye, not the lateral side. But it's don't worry too much about that. So it's mainly around the inner side of the eye, inner side of the eye. So what can you do for benguicula or pterygium? Of course, you need to bring the patient for examination. If the patient doesn't send you a photo, but another option can be a patient can send you a photo. If a patient sends you a photo, so you don't have to bring the patient for examination unless they have any other symptoms. So what could be the symptoms? So symptoms can be eye pain, loss of vision, reduced vision, eye discharge, stickiness of the eyes, eyelids, very important. We also need to know about whether this patient is having any traumas, any injuries. Does this patient wear any contact lenses? Okay, contact lenses. These are very important questions. Okay, of course, we need to ask about the other eye as well. Is the other eye absolutely fine, or has it got similar symptoms? We also need to ask about sun exposure, wind exposure. What do they do for a living? How did that affect them? How is their mood with all of what's been happening? Of course, ask about smoking, alcohol, and work exposure, also family history, and any medications they are taking. Okay, so the question here: what should you do? What should you do? So very importantly, we mentioned about that can be dryness of the eye because of sun exposure, wind exposure. So what can you do? You can offer this patient drops, artificial drops that can help lubricating eyes and can help him seeing better, reducing inflammation, and consequently that can help on the long term. But if this patient the patient's vision has been affected, then the next step is going to be this patient needs to be seen during the same day. The patient needs to be seen during the same day by ophthalmologist. Okay, so ophthalmologist, and the patient has the vision being acutely affected, needs to be seen during the same day. Okay, however, if this patient's vision hasn't been affected at all, and the patient is, worried about that this can get worse, so because you can tell your doctor started as a small dot and then it grew bigger, and now it's covering or approaching the colored part of my eyes, and you can refer this patient into the specialist routinely. Okay, however, if the the pterygium is actually affecting, or like a part of the vision, so that should be urgent or 2-week wait referral to ophthalmology. So again, if vision has completely gone, of course there should be a same-day referral. If the vision has been affected to some extent, so this means a 2-week wait referral to the ophthalmology or urgent referral. If the vision hasn't been affected at all, but the patient is worried about it being affected and is getting bigger and bigger, then refer the patient to a specialist routinely. Dry eyes, always eye drops, very importantly, to try to lubricate the eyes. That's very important, and also reduce sun exposure. This is what the patient can do, wearing eye glasses when they are exposed to the sun. By the way, if the patient is exposed to wind, would they use normal eyeglasses, or are there specific eyeglasses, wind and dust exposure? Anybody knows? There are specific goggles the patient can wear, okay, that can protect the eyes as well, even the patient if gets exposed to dust. Okay, there are specific goggles that the patient can wear, okay, in order to cover the part of the eye from all sides, okay, and consequently that can help with reduction of wind and dust exposure. If the patient is wearing glasses anyway, so they can get the, also be accustomed for them as well. So that's absolutely fine. Of course, you need to safety net the patient against, if the symptoms get any worse, they need to get in touch, and by that I mean any blurring of vision, any redness, any eye pain. So I hope benguicula and pterygium are all now clear.